We're tracking right here on India Today is from Goa. Goa's health minister has broken his silence after scathing attack coming in from the opposition. After a string of deaths, Goa Health Minister says 350 patients have been shifted from old GMC building to a new super speciality block. The old building is where all the COVID patients are admitted and wherein every night deaths were being reported. People were losing their lives. And now he puts out a tweet telling people that the super speciality block is going to be commissioned. And the word used is commissioned at the earliest under the guidance of Chief Minister Pramod Sawant. Question is, can one really wait for this to be commissioned, then built and then take care of the patients when the SOS in need of the hour is to treat patients immediately right now?
The whole problem is with the infrastructure there. The pipelines are very old. And if I'm suppose that Health Minister also wants record earlier saying that the maintenance needs to be done. The maintenance is taken care by the GSIDC, which is Goa State Infrastructure Development Corporation, which is headed again by the Chief Minister. I don't know what is GSIDC doing. They are saying that the pressure cannot reach on the 3rd and 4th floor. Today morning I was coming from Ponda. I could see that, like a bullock cart, slow pace the trolleys were going in a tractor to the factory probably under a police escort. So if this is the situation, if things are going on, I don't know, God only can save Goa.
Saurabh Aktania reporting from Ground Zero is now joining us for the very latest. Saurabh, it's the most shocking thing that the Health Minister of Goa puts out, saying that there are 350 patients who will be moved to the new super speciality block, but that block is still to be commissioned, which means that are the patients going to wait till the block gets commissioned, then gets built, then the infrastructure gets laid out, when the patients right now require SOS medical help, and you can see the patients lying on the floor with the patient's skin, bringing oxygen to them, food to them, whatever their necessities are to them at this point of time. And we are playing those visuals out from Goa right now as far as the state of affairs of this hospital is concerned, Saurabh.
Well, absolutely, Chaiti. First of all, the infrastructure has totally crumbled in the state of Goa. Now, for past so many days, we are seeing continuously patients dying inside this Goa Medical College Hospital. The infrastructure is so bad that the oxygen doesn't properly goes to the COVID ward, and therefore so many deaths we are seeing every day. Now, they have this super specialty hospital right besides this particular GMC hospital. So why it is taking so long for them to commission it? Now, if it is not even commissioned, then why 350 patients have been transported overnight? And why still the Health Minister as well as the Goa's Chief Minister Pramod Sawant not speaking on camera to the India Today's question? Now, let me tell you the current conditions that patients' relatives are actually going inside the COVID ward and supplying them with the necessary food item and other states. And here you can see how the communities are coming forward. These are the people from the Sikh community. See, this is just the visual outside the Goa Medical College Hospital, and they are the people from the Sikh community. They are distributing food, water and all necessary items which a patient will need. They have it all, and these are the people. Sandeep is with us. Sandeep, क्या-क्या सप्लाई कर रहे हो और कब से ये हो रहा है आपका ये काम?
सर, हमारे पास में फूड रहता है और जूस, फ्रूट्स, पानी और जो भी रिक्वायरमेंट कोई एक हेल्दी खाना हम लोग पेशेंट को दे रहे हैं, उसका रिलेटिव कोई भी है, और हम लोग 12 बजे से लेकर 3:30 तक कोई भी आ जाए, हमारे पास में खाना ऐसे चलता रहता है, कंटिन्यू चलता है, 3:30 बजे तक हम रहते हैं.
So this is like a langar seva which is going on outside this Goa Medical Hospital, and such is the situation. See, this is how they are supplying food, water, and to all the people who are actually coming to this particular hospital. But why the officials are not waking up? This is high time, because this is the desperate situation. The condition due to coronavirus in the state of Goa is very, very bad. The positivity rate is very, very low. So
failing to understand here, Saurabh, when the Health Minister said that there is going to be a super speciality block that is going to be commissioned, which means he's talking in the future. What about addressing the problems of these patients who require immediate assistance right now?
They are on their own, Chaiti. Let me tell you, they are on their own. Just now I went inside this particular hospital and there were so many of the patients. They were bringing their oxygen cylinders in the cars by themselves. We tried to ask them questions. They said, the hospital has clearly told us that you need to bring your oxygen by your own self. But when we tried to reach inside the hospital, again the India Today team was stopped from entering inside. We also were risking our lives, but we tried to went inside the COVID ward and tried to get the sense what's the actual picture. And we have brought the visuals from inside, wherein so many patients were lying on floor unattended. And this is the situation, and let me tell you, to stop us, there are so many security guards and cops present inside who are not allowing us inside. And the situation wherein this oxygen malfunctioning is happening, they have made 2 to 3 layers of police barricade over there. So such is the situation. It's a high time when the government officials actually come on ground to this particular hospital and check the ground reality.
The apathy and the failure of the Goa state government, which is coming to the fore at the moment, the visuals playing on your screens say 1,000 words about the reality of what is going on inside these COVID wards, where scores and scores of people are just lying on the floor waiting for medical assistance. Thank you, Saurav, for bringing us the ground report right there. A government hospital in Darbhanga is treating COVID patients in a dilapidated building.